Jane Speech Language Therapy. Last week we talked in general about what swallowing disorders are. If you want to know more about swallowing disorders, please watch my other video. This week I'm going to give you 3 exercises and 3 positioning maneuvers to help someone with dysphagia. So speech language pathologists use swallowing exercises just like other therapists exercise other muscles of the body. We can exercise the muscles of the swallow. These are effective when an entire comprehensive treatment plan is in place and you're working with a speech therapist. So to start us off, 3 exercises to strengthen the swallow. Number 1, this is called the masako, and it's commonly used by speech therapists. What you do is you put your tongue between your teeth and then you swallow, keeping your tongue there the entire time, like this. Number 2, this is called the Mendelssohn maneuver. It's quite difficult. Some people get it right away and some people struggle with it. But if you can get it, it's a really good exercise. So basically, when you swallow, your Adam's apple, or that little notch that you have right here, it's gonna pop up. So when you swallow food or drinks, it's going down and your throat is coming up. And if you feel your throat, you can feel that notch go up and then back down. What the Mendelssohn maneuver does is once you swallow and the food is going down your throat, or the saliva is going down, you hold the notch at the top. So you swallow and you don't let go, and you hold it, hold it, hold it. And while you're holding it, it actually is holding your breath, because for a moment when you swallow, you are holding your breath, and that's where the throat position is in. So you swallow, the notch pops up, you hold it there, then you let go, hold for 3 to 5 seconds. The third strengthening exercise, and exercise to help with the timing of a swallow, is called a supraglottic swallow. What you do is, right before you swallow, you hold your breath, and then you swallow, then you cough. So it has 3 steps. Hold your breath, swallow, and cough. Now for 3 positioning maneuvers to help with the swallow. What these maneuvers are doing is to help prevent aspiration or food or drink going down the wrong way. They help to close off the airway, which is very important when you're swallowing. The first and most common is called a chin tuck. So what you do, or what you teach the person to do, is when they're ready to swallow, after they have some drink in their mouth or they've chewed their food, before they start to swallow, tuck their chin down to their chest, kind of like they're giving themselves a double chin, as I like to say. Like that. And then you swallow hard and fast, keeping your head all the way down. And then you can come back up. With some patients, this is the only way they can swallow safely, and you see people doing that. If you think about it, the general population, if they have a big, amount of food in their mouth, you kind of do this anyway to get it down. That's because when you drop the head, it helps to protect the airway. It opens things up in a different way that makes it easier to swallow. The second positioning maneuver helps mostly with people who have had a stroke that affects one side of their vocal cords. If someone had a stroke and the left side of their body was affected, or the left side of their head was affected, and their left vocal cord was also affected, which is very common, what you do is, when you want to swallow, you turn your head to the affected side, the side that's not working, and then you swallow. That essentially, when you turn your head, cuts off that side of the throat, and the food will only go down the good side. The last positioning maneuver is a pretty obvious one, and that is sitting upright when you eat. It's very important to make sure that the person with a swallowing disorder is sitting up at 90 degrees every single time they swallow anything. It's easier to do this in a chair, but if they happen to be in a bed, sit the bed up to 90 degrees or as far as they can go, and this greatly reduces the amount of coughing and possible aspiration. Thank you for watching. I hope this helps, and look for my other videos on swallowing disorders.